Good afternoon, everyone. Good afternoon. Since COVID-19 first reached Chicago, we made a firm commitment to base our policies and initiatives on the science and the data of this disease, and to communicate these decisions to the public in an open and transparent way. This approach has driven every single one of our actions throughout this crisis, from its earliest stages right on through today, none of which have been easy, but all of which have forced us to make sacrifices, which of course is the most challenging for our most vulnerable residents. But we've done this in order to achieve our singular goal of halting the spread of this disease and saving lives. And our work has begun to pay off. We, meaning you, have not only saved the lives of thousands of Chicagoans by following the guidance from our public health departments. We must also commend the heroic work of our healthcare system and our healthcare workers. There will never be adequate words to thank them, as well as our first responders and essential workers who have been sacrificing on behalf of every resident in our city. We've begun to flatten the curve of Chicago's COVID-19 cases. However, as I said before, we must never confuse promising gains with outright success. We are not at the point where we can begin reopening our city yet. The light at the end of the tunnel is absolutely there, but it's still just a glimmer, and we still have a long way to go before we can safely return to the way things were before. We will get there, but we have to do it in a way we've always done it from the very beginning of this pandemic, to be guided by the data and the science, our public health guidance, period. To do otherwise would be reckless, irresponsible, and of course, deadly. And I will not allow that to happen in this city. That's why today I'm proud to be joining our Public Health Commissioner, Dr. Allison Arwady, and others here to announce the Protecting Chicago framework, specifically designed for Chicago's residents and businesses, and encompassing a clear, data-driven 5-phase process. This framework was created to enhance Governor Pritzker's outline for reopening our state, and tailored to our unique environment here in Chicago, and build on the governor's leadership across Illinois through this crisis. We have been working on these plans for weeks, but we agreed that the state, of course, should go first, and then we would work to harmonize our plans with those laid out by the state. Protecting Chicago framework is more than just a roadmap for city leadership. It's about protecting all of our residents and businesses, as well as protecting the future of our city as we move through this crisis and lay the foundation for the recovery that must and will follow. This also represents a framework for the dialogue we'll be having with our residents and businesses throughout our reopening process, a process of dialogue that's been ongoing throughout. The first phase of protecting Chicago follows the strict guidelines of staying at home and maintaining safe physical distance from anyone who you do not live with. Phase 2 does the same. However, while also seeing us flatten the curve of Chicago's COVID-19 cases, and we believe that we are in phase 2 now. And its rules are the ones we all know well. Only go out for essential activities, brief walks near your home, and when you go out, wear a face cover and practice safe social distancing. Following this phase, when the science and the data allows, we'll move to phase 3, which will be a limited reopening. This includes non-essential workers returning to their jobs in a phased manner, and select businesses, nonprofits, and city entities opening if they can demonstrate a plan for appropriate protections for employees and customers. This phase also allows for a limited reopening of some public amenities and small non-business social gatherings limited to 10 people or fewer. However, make no mistake, this phase still has us wearing face coverings and physically distancing when meeting others. It also has those of you who are sick continuing to stay home. And this guidance that even if you're a little bit sick, that you must stay home will continue for the foreseeable future. Those that are a member of a vulnerable population will also be advised to continue to stay home. And those you've come into contact, and if you've come into contact with someone who has COVID-19, continuing to stay home, as well as immediately contacting your healthcare provider if you have COVID-19 symptoms. Phase 4. Phase 4 sees us reopening a little further, with additional businesses coming back online, more restrictions being lifted, and additional reopening of public amenities, with all residents continuing to wear face coverings and physically distancing, and vulnerable populations continuing to shelter in place. Finally, after all the appropriate measures are met, we will reach Phase 5, our 5th star, which is a near complete reopening of our city. That means businesses are opening up, workers returning to their jobs so long as they're staying healthy, and most activities and events resuming, though possibly with some caveats. This phase will be supported with workplace screenings and tests. I want to pause for a moment to take a special note about our businesses. What I want is for our city to come out of this crisis stronger and more resilient than we've ever been. I want our recovery to stand as a model for other cities around the world. I want nothing less than for our efforts over the coming months to truly warrant a 5th star on our flag. However, we are facing an urgent crisis with scores of businesses struggling to survive, particularly our small and micro businesses, many of whom are truly hanging on by a thread. Based on the numbers we are seeing, if these businesses don't open soon, many will be forced to close their doors entirely. And so, to our businesses, I want you to know that we're doing everything we can to keep that from happening, and will continue to do so throughout every phase of this crisis. Of course, we have to be led by the data and science, and only opening additional businesses when we can do so safely. And the question of safety is one that we will need to continue to be in dialogue with a variety of businesses by type, sector, size, and that will also influence and inform our public policy. In a moment, Dr. Arwady will be offering details on the specific metrics we'll need to see in order to move from phase 2, where we are now, to the next phase of our reopening. But they really boil down to answering 4 key questions. 1, is there a decrease in the rate the disease is spreading? Critically important. We've seen progress, but not a decrease yet. Do we have testing and contact tracing available to track the disease and limit its spread? Are there enough systems, support systems in place for our vulnerable populations? And last, can our healthcare system handle a potential case surge? If the answer is no to any of these, then we simply cannot and will not move to the next phase. We will also, if necessary, take a step back if that's where the data leads us. Over the next several weeks, we'll be providing further details for businesses and public amenities related to each phase of our reopening based on the continued dialogue with each sector in our city. And to that point, as I mentioned earlier, protecting Chicago is more than just a framework for city leadership. It's also a framework for continued dialogue. Protecting Chicago itself was created in partnership with community and industry working groups from across our city. We want this process to continue to be an important and rigorous dialogue between residents, businesses, and local organizations. One size does not fit all. As I said to the alderman earlier today, we need to hear from all of Chicago in order to develop the best ways to reopen safely and move our city forward. Toward that end, we've created an online survey to hear from residents directly on the ways you can best support our reopening. Your responses will shape our decisions on where we need to place greater emphasis and how we can make our reopening as smooth and supportive as possible. And I encourage Chicagoans to fill out this survey by visiting our city's COVID website, chicago.gov/coronavirus. The survey is simple, it is short, and it is anonymous. These next steps will be important and encouraging, but we can't get ahead of ourselves. This is a framework we'll need to operate in until we have a vaccine for COVID-19. And regardless of what you may be hearing elsewhere, the truth is we do not know right now when a vaccine will be available. All of us, of course, want it to come as soon as possible. But at this point, we don't anticipate having one until sometime in 2021. And I'm going to say that again. We don't know when it's coming. We hope it's sometime in 2021, but it's not here yet. Until then, the structure of our lives will continue to be based on how we can safely move around. How do we maintain social distance, even as we gradually open up and come back together? How do we take care of and safeguard our most vulnerable residents? Critical questions for us to be able to answer. All that means is continuing our rules related to face coverings, hand washing and sanitizing, and physical distancing. I take very seriously my responsibility to keep our residents safe every day in any way that I can. And I want to thank the residents for everything that you've done to stay home and to save lives. It's been critically important. It's made all the difference in the progress that we've made in the city, but we have to maintain that vigilance and diligence in making sure that we are continuing to follow the public health guidelines. I also want to thank the countless individuals and organizations who've really stepped up in remarkable ways for helping their fellow Chicagoans in this time of great need everywhere. As hard as it's been, we are getting through this, but we must continue to work hard and be diligent. This is truly an experience like none we've ever seen before, and we have to do it together as one city in a recovery that will make all of us stronger and more resilient and more inclusive than we've ever been. And at this point, I'd like to invite Dr. Arwady to the podium to provide details on the health metrics that will be guiding our progress forward. Doctor?
Thank you very much, Mayor. So it's my job to give you a first look at the specific public health data we'll be using as Together We Protect Chicago. My team of epidemiologists or data scientists at the Chicago Department of Public Health track these and many other metrics every day. And we've chosen some of the most important indicators that will let us know that it is safe to move forward as a city. I want to be clear that these indicators are in no way in conflict with the broader state framework, but they allow us to follow our local outbreak in much more detail and, as always, direct resources to where they are most needed. We have defined 7 indicators that, in combination, will let us follow cases, hospital capacity, testing capacity, response capacity. We have to be sure that as a city, we are making progress in all of these areas. We are all so anxious to get as many people back to work as quickly and safely as we can, and to get us all back to our new normal. Following this data over time will let us do this in a data-driven way and will let us protect Chicago. I'll give you a quick sense of where we are on each of them. The details are meant, as the mayor said, to guide the next stage of our transmission, from stay at home to cautiously open. You'll get a sense of where we've made the most progress based on where those yellow stars are. The stars further to the right signal the ones that we're already further along on. We want to be absolutely transparent about the local information that we're using to make these decisions. So I'll be talking in more detail about all of these indicators on the Facebook Live that I do at 11 every day, and we'll be posting on the website details about each indicator with graphs that you'll be able to track over time to see how we're doing in each of these areas. I want to be clear that the stars may move at a slightly different pace, but fundamentally, we need to be able to say yes. Are the cases going down? Yes. Can our hospitals handle the number of people who are seriously ill with COVID-19? Yes. Are we testing enough as a city? Yes. And are we building up our response capacity to be able to meet the demands and protect Chicago, not just right now, but all the way through recovery? Yes. Let's look at them quickly. The first two indicators have to do with the basic question of whether cases are going down. As of today, we have 28,567 lab-confirmed cases in Chicago residents. We have 1,206 deaths in Chicago residents. We are adding cases every day, 999 cases just since yesterday. We need to see that rate of increase not just flatten, but be on the decline. But we also need to potentially correct that for the increase in testing that you've seen. And so, for example, the state chose to call out a 20% positivity rate as sort of a sign of making progress on cases. Currently, here in Chicago, we're at approximately a 26% positivity rate. But I'll tell you in a minute how we want to get at that amount of progress. But also, we don't just want to follow the overall cases. The second indicator gets at cases by looking at the severe outcomes. So that's the people who need to be hospitalized, need to be in the ICU, need to be on a ventilator, or unfortunately die. Because in those settings, we've had very good testing from very early on. So we don't have this problem of the change in testing. We are seeing flattening and just the beginnings of decline in a lot of these. We want to see these declines for all of the time-based indicators on an average over 14 days so that we know we are safely making progress. The third, really gets at hospital capacity. And here, we put this right into our Chicago context. So at the state level, they talked about making sure that we had at least a 14% surge capacity. But that can be a little complicated to define because here in Chicago, our hospitals have already surged a lot to meet the demand, particularly in the ICU. And so every day we do follow. We know that, for example, right now about 20% of the ICU beds are available in Chicago. But what we wanted to do was turn this into something that we can follow and everybody can understand over time. And so we've set some pretty specific goals. We've said, for example, that our hospital beds outside the ICU, we don't want to see more than 1,800 COVID patients needing non-ICU beds in Chicago hospitals. Right now, we're at a little bit under 1,200 on that, so we're doing okay. We right now have 480 patients in the ICU in Chicago hospitals. We really can't handle more than about 600 COVID patients across our ICUs. We have 321 patients, COVID patients on ventilators. We can't handle more than about 450. And so setting these concrete numbers helps us understand that as we open, as we potentially see some small increase in cases, we don't run the risk of overwhelming our healthcare system. The next indicators are all about testing capacity. So again here, the state has said we need to make sure that we can test across a range of different groups. Obviously, we agree with that, and we're working towards that. But we wanted to set some more specific goals. And so specifically for testing capacity, we're really saying, by the end of the month, our goal is to be able to test at least 5% of Chicago residents every month. That works out to us being able to do 4,500 tests a day here in Chicago. We're at about 3,000 tests a day here in Chicago, so we're hoping to grow that by about 50% just over the next few weeks. And certainly, as more federal testing resources have come through the state, and the state's been partnering to push testing resources in, we've seen that grow. We've got other plans to grow that. But we feel that that indicator gives us a place for this next stage to feel confident that we're doing enough testing. But we're not just using that number. We're looking again at this percent positivity rate. And that has to do with how many tests are positive divided by how many tests are you doing overall. And really, if I was going to choose one factor, this is the one that helps you know how you're doing as a city, as a state, as a country. The way you see your percent positivity come down is either by bringing down that top number, having fewer new cases, or by increasing that bottom number, doing more testing. So where we have a percent positivity that is high, we need to do more testing as we see the cases come down. And so we're defining, we actually want to set some different goals for the tests that we do in our congregate settings, meaning our nursing homes, potentially in the jail, in our homeless shelters, where we actually are expecting to find some more cases, and we want to set a slightly lower goal for a percent positivity that we're seeing in the community. These are not final goals, but we wanted to set, some idea of where we're really hoping to be as we move into the next phase. Syndromic surveillance is a way at understanding what cases are looking like as people come into the emergency department without needing to test them. It helps us put a finer point on case rate, hospital capacity, and testing, and so that's another one that fits in. And then finally, our capacity for response, case investigation and contact tracing. We already are growing this capacity, but we want to make sure we have an expanded system in place, and we're doing all kinds of work to grow that over the next few weeks to make sure that while we track these metrics, we of course are responding. So we will see these move at different levels, at different points over time. The big buckets, we are confident that we will see the movement that we need to as long as people through the month of May continue to abide by the stay-at-home order. That is what has flattened the curve for us so far. That most fundamentally will get us on the other side and going down. We'll watch the hospital capacity, we'll build the testing capacity, and we'll build our response capacity. All of these together, we feel confident that we will be able to move ahead, not just our next step, but throughout this response. Our goal is to use data to protect Chicago and get us all back to our new normal. And with that, I will bring up Samir Mayakar.
Thank you, Doctor, and good afternoon, everybody. I'm here to talk about engagement. As you heard from the mayor, our process for reopening the city is one that involves dialogue and communication. You've just heard from Dr. Arwady about the health guidelines that we need to move to the next phase. But what's on probably a lot of your minds is what will happen within each phase? What will life look like? And per that end, we've partnered with industry, with community organizations, and with organized labor to help us develop detailed playbooks of guidelines within each phase. Now, as a former small business founder, I know that we cannot take a one-size-fits-all approach to our industry. We need to listen to the nuanced needs of various types of businesses. And that's why we've launched 10 industry reopening groups. Those groups are going to focus on safe interactions for workers and for customers. They're going to think through the details about protective gear, about hygiene standards, about capacity constraints. And in the coming weeks, you will see guidelines that are very detailed in terms of what will the next phase, the cautiously reopened phase, look like. Finally, in addition to engaging industry, we want to hear from you. And that's why the mayor has requested that you all, as Chicago residents, take our survey. And as she mentioned, you can visit chicago.gov/coronavirus. We truly hope you'll fill out our reopening survey because we want to hear from you. And with that, I'd like to turn it over to one of the members of our industry working groups who's been a valued partner of ours here in City Hall, and that is Sam Toya with the Illinois Restaurant Association.
Thank you, Samir. I'd like to thank Mayor Lightfoot for her steadfast leadership throughout the ongoing crisis. I always say communication and education is the key to success. Mayor Lightfoot and her team are always communicating and educating, and they also want to be educated and communicated back with. We really appreciate that. As you all have heard, the City of Chicago is taking a thoughtful approach to reopening our economy by assembling experts from all industries to offer recommendations and best practices. These working groups represents the breadth and diversity of Chicago's business community and the many individuals we employ. I'm honored to lead the working team focused on the food and beverage sector. And let me go deep on that. So we got restaurateurs and beverage sector people from the south side, the west side, the southwest side, the northwest side, north side. We have a great working group. When we are offering our thoughts and feedback on the state's plan, which we believe underestimates our ability to operate safely. On a day-to-day basis, restaurateurs are focused on the health and safety of our customers and our team members. This isn't new to us. Even before the pandemic, restaurant operators have been held to the highest health standards. Restaurants are the cornerstones of our 77 communities here in the culinary capital of the United States. Under Mayor Lightfoot's leadership and with this joint effort between civic, business, and community stakeholders, we look forward to getting back to work safely. Thank you.
And now we're happy to get myself back together. Happy to take your questions.
Thank you, Mayor.
Sure.
This plan, like the governor's plan, does not have dates like we have seen with some other states. What about that? Folks are anxious to see, okay, when will I go to my favorite restaurant? When will my child go to summer camp? Why no dates associated with the plan?
Well, that's very easy because we have to be guided by the science and the data. And we can't predict and put a stake in a particular date to say this is going to happen this way or that way. This virus has been unpredictable really from the very beginning. You'll recall back in March, we really were worried greatly that we were going to see a huge spike in cases that would overrun our healthcare system. Luckily, that didn't happen. Even in the last 2 weeks, we've seen a lot of fluidity in what we're seeing in the data. So we could put a date out, but it would be completely arbitrary, and it wouldn't be governed by the science and the data. We have to be led by what the public health experts are telling us. And so we believe that we have set out a framework that is workable, that makes sense, that is data-driven. But when the precise dates are, when we hit those metrics and those milestones, we'll only know when we get there.
Can you tell us if you consulted with the governor? Did you show him your plan? Did you get feedback from the governor? How have those discussions gone? When's the last time you spoke? Not just myself, Dana Kozlov is asking that as well.
I spoke with the governor earlier today. We talk virtually every day. He read me into, at a high level, what their plans were. Obviously, we now have had the opportunity to see it in detail. This is something that both of us, meaning the state and the city, have been working on for weeks. And so we talked several times about a framework, talked about phasing. We've talked about gradual reopening. So, yeah, those conversations have been taking place for some time.
There are some discrepancies, including differences between the two plans, positivity rate being one of them. We've asked Dr. Ezike about that. She told, her answer is those congregate settings, which others have also decided to take those out. Indiana takes it out as well. But she has answered that question before, and I'm not quoting word for word, but those folks that work in the nursing homes or work in the jails live in the community and therefore go to grocery stores and wherever. So she feels they should be part of that positivity rate. But I'm hearing a different answer from all of you today on
Yeah,
that.
I don't think that's quite true. I'm going to invite Dr. Arty up to answer the specifics. But look, if you read the fine detail of the governor's plan, and I have, and probably many of you have as well, you see that it allows for specific cities and regions to come up with region-specific plans. Obviously, the governor's plan is one that covers the entirety of the state, but there's a lot of differences between, Chicago and Cairo, from us to Peoria and Champaign-Urbana. So I think the beauty of the governor's plan is it allows us to use local specific data to dig down into particulars on how we're going to protect the city of Chicago based upon the data that's different here than it is in other parts of the state. It would be impossible to have a one-size-fits-all plan, and we read the governor's plan as giving us the flexibility to offer up specific local guidance, and that's what we're attempting to do today. But do you want to?
Yeah.
Yes. Okay.
Thank you.
So I'll just add briefly, again, no significant conflict here, but it really has to do with the different approaches that we are taking at this stage in terms of outbreak response. In our congregate settings, that is where really we're looking to do universal testing. We anticipate actually, and we have already found many more cases, including people who are asymptomatic or pre-symptomatic. And so in the investigations that have a public health response, we use that percent positivity not just once, but over time. We go in, we do some serial testing, we do interventions, we then come back. How are we making progress? How are we making progress? And so having some goals and some overall plans that we want to see decreasing, it's just a completely different part of the response than what happens in the community-based settings. In the community-based settings, that's everybody who is getting tested through their provider or who is coming into a hospital. And so that 15% goal is one that we want to see across the city. But in the same way that within Chicago, we are really wanting to push more resources, more testing resources to parts of the city where we see higher positivity rates. That's another reason why we need to push more, testing resources across parts of the state that have higher positivity rates.
Also a question from A.D. Quigg at Cranes about the difference of the 28 days in the governor's plan and the 14 days in your plan. What should we read into that? Will that mean that perhaps the city will move more quickly at 14 days, or will that make it tougher to meet?
So I would say, so the 14 days is based on the incubation period, it's called, for the virus. So from the day that somebody is exposed until the day that they can develop symptoms, that is up to 14 days, right? That's why we quarantine for that amount of time. And so it's fairly standard to use an incubation period, and we wanted to use the same metric across all of the time-based metrics. But what those actually mean is that's the average that we look at all of our data over. So if you say you had 7 cases on this day and 8 cases on this day and 4 cases on this day and 9 cases on this day, you'd want to average that out over a certain amount of time and not make a decision based just on one of those days. So using a 14-day average lets us know as a city in all of these ways whether we're making progress broadly.
When does that date start?
Oh, it's a continuously moving date. And so you're always looking back, you use it to smooth the data. It's really a standard way of approaching all of these across the country.
Thank you.
Yep.
Mayor, the Chicago Teachers Union spoke earlier before your meeting and said that they were not consulted, and they're concerned with reports that you are interested in making sure school starts without their input. They're worried about safety.
The Chicago Teachers Union is constantly consulted by CPS. What I articulated today was a goal to get our kids physically back in school. Of course, it's going to be guided by the science. It's going to be based upon feedback from the entire school community, which of course includes the teachers. So I articulated a goal, and the reason I articulated that goal is this. When I think about the youngest children, those pre-K and kindergartners, first, second grade, if we don't cement the love of learning in those children at the earliest age, if we are not making sure that they are really understanding social and emotional development, if they are not getting those kinds of supports, you know that in Chicago, schools are more than just a place of learning. They're a place of comfort and safety where our children are fed and they are nurtured. We need that school structure. It is important to the health and well-being of our children. And yes, we have been doing remote learning, but better yet, to be right in close proximity to your teachers. Now, we're not going to do that if we don't, if the data tells us something else. We're not going to do it if we can't keep the entirety of the school community safe. But of course, I have an aspiration that our young people are going to be back in school with their teachers so that they can learn and thrive and be nurtured.
Do you envision perhaps a staggered, a morning class or a Monday, Wednesday class or any kind of staggered learning?
Dr. Jackson and Dr. McDade and their teams, in consultation with teachers and principals and the various unions that represent the janitors and the school lunchroom people, they are all starting that conversation about a way in which we can do this safely. Again, the gating issue is, what does the public health data tell us? But if the public health data tells us that we can come together in some altered fashion to be in schools, then that's something that we should all aspire to.
Stacey Baca from WLS ABC 7. As we go into phase 3, what does it mean for transit? What will commuting look like?
That's a great question, and we are deeply in discussions about that. And in fact, I'm having a call later today with Dorval Carter, the president of the CTA. What I know is this. We have been working very hard from the very beginning of this pandemic to make sure that our public transit system is safe, it is clean, and that it's not, and that people have confidence that they can ride without worrying about getting infection. That work is ongoing. One of the first things that we did is to really substantially increase the amount of cleaning on platforms, in trains, in buses. The CTA moved those kind of double extension buses to some of the heavy traffic areas on the south and the west side, and then limited the number of people that could get into buses. We did rear boarding to help, again, keeping people safe and keeping the bus drivers safe. So we're going to continue to think innovatively about ways in which we can move more people, but move them safely. President Carter is on a weekly call with other heads of transit union or transit systems across the country. We're borrowing from this system and that, and they're borrowing from us. So we're doing, I think, a lot to think about best practices and be innovative. But the other thing I think is also going to be true. For those companies and businesses where they can telework, what we're hearing is they're not coming back downtown en masse for months to come. Maybe midsummer, maybe not to the fall. So I think the volume of traffic that we normally would see in normal conditions, we move the population of Philadelphia every day on our public transit system. I don't think we're going to see those numbers return for some time. Now, that's a challenge, obviously, financially, but I think that we can put together a balanced approach with our regional partners. That's going to be critically important. You know, people from the suburbs come to Chicago, people from Chicago go to the suburbs, and a lot of them are using public transportation. That's why the regional partnership that's part of our recovery task force is so important. But we are thinking through what that looks like, and we'll make sure that we do it in a way that's safe.
Craig Delmore from WBBM Radio. What is your team hearing about the percentage of businesses like restaurants in the city that might not survive to see a recovery? And what will that mean long term for those employees?
Well, look, you know, Sam can probably tell you chapter and verse when it comes to the restaurant industry. But look, I know that those businesses, a lot of the businesses, hospitality, hotels, restaurants, service industry, they are suffering mightily. And they've taken a body blow with these closures. and you've heard me say this before, and I'll say it again, those small micro businesses that may employ, 4 employees or less, they're all over the city. If we don't do something soon to breathe new life into them and help support them, some of them are never coming back. So that's why it's important for us to be in dialogue with our business partners to understand and let them innovate and tell us ways in which they can bring their businesses back online safely when we know from the public health data that we can.
So perhaps might restaurants open sooner in the city than the governor's plan if there are capacity restrictions? I've heard that that's what Mr. Toya has spoken about, that if we wait 60 days, that it's just way too long?
Look, the conversation that we've had and we had just today is, first and foremost, we're going to be guided by the public health guidance. And as Sam said earlier, no restaurateur wants to reopen and put themselves, their employees, or their customers at risk. So that's why it's important for us to be guided by the science, continue the dialogue that we've been having, and think about creative ways, borrow from other cities across the U.S., other cities across the world. We're seeing a lot of different interesting, innovative things that are being done by restaurateurs who are in a place where either their state or their country or their region has said, you can open back up. We're going to borrow from those best practices in partnership with Sam and his colleagues across Chicago to think of innovative ways in which we can bring restaurants back on. None of us can tell you what that date looks like because we haven't met our mark, but when we do, we'll be ready.
Mr. Toya, could you weigh in, because somebody want to hear from you, because you have said if we wait until the end of June that that's just too late. I believe you're probably here lobbying more for a faster opening.
Okay, let me start out by saying all restaurateurs care about the health and safety of their team members and their customers, number one, right? So when the pandemic started, none of us saw this lasting, as long as it's lasted. We heard the president say we would be open by Easter. We're more progressive here in the city of Chicago. We thought, okay, maybe we'll be open by May. Well, now it looks like, we're not sure yet. Like I said, we have to see the data as we move forward. We want to make sure everyone is safe and healthy, customers, team members. So as we look at this, again, it is definitely restaurants are hemorrhaging, right? So we don't know how long this is going to be. But no business model can last a third of the year with no income or only 20% of their income. So that is our concern. But we don't want to be ahead of anyone. We want to hear what the scientists and doctors have to say, because that is very important. We're a very progressive city when it comes to the health department. Throughout the state, we are. So we get health and sanitation in a restaurant. We're a very regulated business, so we don't want to put anyone at our rate. But we do are concerned about our restaurants. That's why at the federal level, we think that the next CARES Act, Phase 4, we need federal dollars there for just restaurants alone, like they did for the airlines, like they did for the banks, like they did for the auto industry. So that's really what we want to see. And CARES Act, Phase 4, we've talked with Senator Durbin, we've talked with Congressman Garcia, we've talked with Congressman Quigley. They understand our concerns. So the federal government needs to step up, have in CARES Act Phase 4 money for the restaurant industry, because restaurants are the soul of every neighborhood throughout the country.
In fact, Mayor, one restaurateur asked us, why are they still expected to pay their 2-year liquor licenses and other bills that are owed? This restaurateur owns $5,000 by June, but his restaurant's not open. So how is he going to be able to make those payments?
So we've been having those kinds of discussions, and we've obviously given some relief to a number of businesses that are really suffering during this time, and we'll continue to have those discussions, and if we can do something more, then we will.
Amy Jacobson from WIND Radio. If Chicago sport teams cannot play in front of fans later this summer and fall, do you what do you think of the idea that they might be playing in neighboring cities or neighboring states? Have you calculated the economic cost of losing these events?
Well, look, we've certainly been in contact with the various sports teams at the league level, but also at the individual team level. They're not going to do anything that puts their athletes in harm's way. And they're not going to do anything that puts the various businesses and employees that depend upon those teams and the leagues at risk. And we have to be guided by the data and the science here. I don't see a world in which all those sports teams leave Illinois because we believe in making sure that we're cautious in our reopening. But I think the conversation really has been about having teams start to play, but maybe do it without fans. But that's an ongoing dialogue that we're having with them.
In your plan, Becky Vivi from WBEZ is asking, Phase 3 says select businesses. City agencies will open, quote, with demonstrated appropriate protections. What does that mean? Temperature checks, furniture 6 feet apart? What does that mean?
So on businesses, it's just what we've been talking about. We have these 10 different industry sectors. We're going to be looking for suggestions and recommendations from them on how they can safely open and how. For example, I'm going to focus on the restaurants. There are some restaurants in the city that have big, huge dining rooms where you're packed in, right? That's different than a smaller walk-up place. Different still from a restaurant that has family tables. So we've got to look at not only by sector, but within the sector, the size, the quantity, what makes sense for those different businesses and other organizations to be able to open up. What protections are they going to be providing to their workers, to their customers? So those are all the kind of micro questions that we are asking now in partnership with these various sectors. For City Hall, we're asking the same kinds of questions. Again, on a conversation with Alderman today, I said, we need your feedback on what you can see and how we can open up the building safely to protect our workers and protect the public. And so there's a range of different options that are available, and we're looking at all of them. But yeah, I could see a world in which we have buildings where you do temperature checks before you walk in, where we require people to be masked up before you can walk in. I think I've seen some businesses already with signs that says no mask, no admittance. So I think there's going to be a variety of things and options for us to choose from. And again, it's really going to be dependent upon the sector, the particular place-based strategies. And then when we do that, particularly when we're talking about small neighborhood businesses, we've got to also, we know, step up and help support them by providing PPE and masks and gloves and so forth.
Multiple questions about the lakefront. Will you be opening the lakefront and the parks and the playgrounds in Phase 3, the 606 Trail, the Riverwalk? When might those be opened?
Again, a lot of that is going to be guided by the science, and I've got to be confident that we can open up those larger venues, the lakefront, the 606, and other interior trails, in a way that still allows us to maintain social distancing. When I made the hard decision, but I think appropriate decision, to close down the lakefront, it's because we talked, and people ignored it. And now the weather's even nicer. The lakefront is beautiful. It's an incredible attraction. We can't reopen it up and go back to where we were. So people have been sending me, I think, really interesting suggestions about a phased reopening, even having segmented hours for particular types of activities. I think those are really interesting ideas. So we're going to be having more conversation with our Parks Department, of course, but also with the local aldermen who touch the lakefront, and figure out a plan that makes sense, dictated by what the public health guidance tells us.
The mayor of Boston today canceled all festivals, parades through Labor Day. Mm-hmm. Is that really what you're talking about as well? Might we see a block party? Craig Wall is asking that one. Could we lump all that together?
I think a lot of that depends on where we are in the arc of this virus. Are we seeing a decline or not? I don't see us early in phase 3 throwing it back open again, but could I see circumstances at some point in the summer where, with limitations on numbers, limitations on space, and the appropriate kind of social distancing and mask and hand sanitizers, that we could slowly see outdoor gatherings? Possibly.
John Greenfield is asking whether or not, would there be perhaps social distancing ambassadors, somewhat like, we have the safe passage workers. Move along, keep going, don't stay here, but at least be able to take that walk on the lakefront.
Yeah, I mean, that's frankly one of the things that I was alluding to earlier when we were talking about the lakefront and the parks. I think a lot about the ushers at Wrigley. They're pretty tough. And they're checking your ticket. They're making sure you're going to the right seat. We need to have the same kind of rigor, I believe, in thinking about reopening our parks and other big public spaces. So I see that as another area where we're going to be employing people where those jobs didn't exist before.
Madeline Forse from Fox News is asking about funerals. There have been many funerals we have witnessed recently where there are more than 10 people, and the CDC has traced some of the outbreaks here in the Chicago area to a birthday party and a funeral. What more can you do beyond what you've already done to work with funeral home directors? How can you enforce it?
Yeah, I mean, funeral home directors are in a really unenviable position, and we've had a lot of dialogue with them because it's really tough. When somebody passes and the family is grieving, they want their village around them for support, and we absolutely get that. But your point is well taken. We know that there have been spread and even deaths related to funerals. So we've got to be really careful about those kinds of settings because they seem to be a place where the virus spreads.
Last two questions.
All right. One from John Dempsey from WLS Radio. Dr. Arwady, there have been some studies showing there is a low likelihood of outdoor transmissions. Have you seen those, and could they inform decisions on then perhaps reopening the lakefront? What about outdoor transmissions?
Yeah, so certainly this has been one of the, I think, the richest areas of conversation. As we've learned more and you've seen some of the studies come out that suggest that certainly sunlight, it has the ability to make the virus not last as long, for example. It does not eliminate the risk of the virus. It does not make it that being outdoors has no risk at all. But I think we are coming to some understanding that outdoor activities with the appropriate social distancing, hand washing, all of those other things probably have less of a risk of transmission than indoor ones. And so, as the mayor said, as we're thinking ahead, I think particularly to the summer, which is when people are most interested in outdoor activities in Chicago, wanting to make sure we're bringing that part of the science into the really specific plans. But we've got to be coming down on the other side of this before we can be seriously thinking about moving in that way.
My final question from Stacy Baca. How about one-on-one appointment-only businesses? Whether it's a hairstylist, an attorney, an accountant, a tax preparer, when can they start working? One-on-ones.
Yeah, I think that those are the kind of things that we could envision in phase 3. But again, it's going to be dictated by where we are with the various metrics that Dr. Arwady laid out. But with those businesses, just as with any other business, they're going to have a very tight plan to make sure that they protect their workers and they protect their customers. But I could see some of those settings being appropriate in phase 3 once we get there.
Thank you, Mayor.
Sure.
Thank you, Mayor.
Thank you.